programme for government committed to the establishment of the public sector aid commission. It also commits to increasing frontline staff, especially nurses in our public hospitals, and it isn't happening. And you've heard from a number of deputies that the Sacred Heart ward in St Joseph's Hospital in Dungarvan was closed. I spoke to the Director of Services of Community Services in the HSE today, and he says that the only reason why that ward was closed and those beds were closed, and we're dealing here with rehab beds for stroke victims as well, was because the hospital simply cannot recruit nurses. And hospitals cannot recruit nurses because up to this day your party and the Minister for Public Expenditure and Reform has still not committed to the principle of equal work for equal pay. We have commissions in relation to pay restoration, but we don't have any fairness. And we have said to you over and over and over again, if you don't deal with these issues, there will be consequences. We're now seeing the consequences where a ward has been closed in the community hospital in Dungarvan, and it's unacceptable. And I want to know what the Taoiseach is going to do to make sure that we can recruit nurses into our public system.
Jackie Cahill. Taoiseach.
Well, the Minister for Health has gone to exceptional lengths to improve the position insofar as young trained nurses coming out from Irish hospitals are given full-time contracts. Thank you. And actually has also made available incentives for nurses to return home to work here in Ireland. So I don't accept the figure that you mentioned of 85% of every trained nurse coming out of the Irish situation is emigrating. Some people will want to go abroad to work for experience, as all young people do. But the situation is very much better than it was, Deputy McGrath, in respect of the opportunity and the incentive now for young nurses coming out who are very highly trained and very much in demand to work in the Irish hospital system. The decision that Deputy Cahill refers to about the psychiatric situation in County Tipperary, that decision was made quite a number of years ago, and surely it's a situation that can be worked out if you've got a new facility up the road and another one's closing down. Obviously, it's just not a case of saying what is the best option here to provide facilities for people. I mean, the new unit wasn't built to be a new unit that remains empty and unused. It was built for a purpose, and obviously that purpose should be able to be followed through. Some of these matters are relevant to topical issues at Councora. Yes, I don't have the details of them here, but I will respond to the deputies who have raised questions about Dungarvan and about Clonmel and about Cashel, and have the
Thank you very much.